Hey, welcome to Clinical Knowledge Bridge. If you are new to this channel, please subscribe. In this video, we are going to learn one of the key updates in ICH GCP E6 R3, and that is strengthened participant protection and ethical considerations. Also watch our videos on quality by design and risk proportionality, enhanced data governance and integrity, integration of technological advancements, and clarification of stakeholder roles and responsibilities. Clinical trials are the foundation of medical progress, but their success depends on trust and participant safety. For years, good clinical practice, GCP, has set the rules for these trials. Now, a major update, ICH GCP E6 R3, is transforming how we protect research volunteers. This isn't just more paperwork, it's a cultural shift. E6 R3 weaves ethics into every step, from study design to final results. Everyone involved, sponsors, doctors, nurses, must keep the participants' well-being at the center. The world of research is evolving fast, with digital health tools and complex studies involving vulnerable people. These advances bring new ethical challenges, like protecting data collected by apps, or ensuring informed consent in remote communities. E6 R3 addresses these modern issues, keeping ethics in step with innovation. The new guidelines strengthen the partnership between researchers and participants. Trials are no longer done to people, but with them. By emphasizing protection, transparency, and engagement, E6 R3 builds trust and encourages participation. This trust leads to better data and ultimately medical breakthroughs that benefit everyone. When participants feel safe and valued, science moves forward. The journey of medicine relies on volunteers, and now their safety is more central than ever. E6 R3 is a promise. Participant protection is not just a rule, but the heart of research. The future of healthcare depends on this commitment. At the core of E6 R3 is a powerful principle. Participant well-being comes first. Every decision in a trial must prioritize the rights, safety, and welfare of volunteers, above science or society's interests. This starts at the design phase, where researchers must minimize risks and burdens for participants. Ethical pillars like respect for persons, beneficence, and justice are now practical requirements, not just ideals. E6 R3 demands these values be demonstrated and documented throughout the trial. For participants, this means greater security and confidence that their safety is deeply considered. The shift ensures research is both scientifically and ethically sound. E6 R3 reaffirms that every volunteer's dignity and safety are the foundation of medical progress. If you are finding this content helpful, please like the video and subscribe to our channel, Clinical Knowledge Bridge. Informed consent is no longer a one-time signature, it's an ongoing conversation. E6 R3 requires that participants continuously understand the trial, its risks, and their rights from start to finish. If new information arises, like a side effect, participants must be informed immediately, empowering them to make real choices. Modern tools like e-consent use videos and interactive content to make information clearer and more accessible, especially for remote or rural participants. Regardless of the method, the core principle remains. Information must be clear, understandable, and open to questions. Special safeguards are required for vulnerable groups: children, those with cognitive challenges, or the severely ill. This may involve legal representatives or tailored materials, like stories or comics for children. The goal is always to respect and protect each individual, ensuring their consent is truly informed. E6 R3 transforms participants from passive subjects into active partners. The consent process is now a living dialogue, not a checkbox. This approach builds trust and empowers volunteers. Informed consent is now about partnership, not paperwork. Every participant's voice matters throughout the trial. Every clinical trial is overseen by an independent ethics committee, IRB or IEC, tasked with protecting participants. E6 R3 expands their role from gatekeepers to active, ongoing guardians throughout the study. Committees must now review protocol changes, new safety data, and progress reports more frequently. If new risks arise, they have the authority to demand changes or halt the trial to protect participants. Oversight is now risk-adapted. High-risk trials get more scrutiny, while low-risk studies are streamlined. This smart approach focuses resources where they matter most. Ethics committees are impartial advocates for participants, with no stake in the trial's outcome. Their expanded powers and flexible oversight strengthen public trust in research. E6 R3 ensures there's always an independent protector for every volunteer. The system of checks and balances is stronger than ever. Participant welfare is always the top priority. E6 R3 introduces risk-based quality management. Oversight and resources are matched to the actual risks of each trial. Sponsors must identify and manage risks to both participants and data from the start. Instead of checking every box, teams focus on what truly matters, like monitoring for serious side effects or ensuring informed consent is done right. This smarter approach protects participants more effectively and uses resources wisely. For volunteers, it means safety systems are tailored to their needs, not just bureaucracy. Quality management becomes a dynamic process, not a paperwork exercise. The focus is always on protecting people, not just following rules. Digital tools, wearables, apps, remote monitoring are transforming clinical trials. E6 R3 sets clear standards for digital ethics, ensuring participant protection keeps pace with technology. Data security is paramount. Information must be encrypted, stored safely, and handled transparently. Participants must know what data is collected, how it's used, and how it's protected. Digital devices must be validated for accuracy. No decisions are made on faulty data. Technology should never exclude anyone. Trials must remain accessible to all, regardless of digital literacy or access. E6 R3 ensures digital innovation serves participants, not the other way around. The guidelines provide a roadmap for ethical, inclusive digital research. Trust and safety remain at the core, even in a digital world. Modern trials involve many players: sponsors, investigators, labs, tech companies. E6 R3 makes participant protection a shared responsibility across all parties. Sponsors hold ultimate accountability, even when tasks are delegated. They must select, train, and monitor partners to ensure GCP standards are met. Investigators are responsible for site-level safety, protocol adherence, and ongoing informed consent. Every party's role and obligations must be clearly defined in writing before the trial begins. This web of accountability ensures no gaps in participant protection. E6 R3 builds a resilient system where everyone is focused on safety. The participants' welfare is always the guiding principle. E6 R3 marks a new era in clinical research, one where participant safety, rights, and trust are central. The shift from checklists to embedded ethics transforms research culture. Informed consent is now a true dialogue. Ethics committees are vigilant protectors. Risk-based management targets what matters most. Digital and decentralized trials are guided by clear ethical standards. Shared responsibility creates a robust safety net for every volunteer. These changes honor the courage of participants and promise their safety comes first. Together, we build a future where medical progress and human dignity go hand in hand. Thank you for watching. Please like the video and subscribe to our channel, Clinical Knowledge Bridge.